Hi, this is Rob with Wad Body Sports Massage, and today I'll be telling you how to self-massage your sternocleidomastoid muscle. That's this muscle right here on the front of your neck. That goes from your sternum and your clavicle up to the mastoid process of your head. This muscle helps you bring your chin down towards your chest when you're looking down, and also helps you turn your head to the opposite side. I want to talk about this muscle because for a lot of us, this muscle is very short. With our typical routines and postures today of looking at a computer monitor all day, looking down at your cell phone, even driving, this muscle tends to get very short. The problem is we don't feel the pain in the muscle, the pain gets referred elsewhere. And a lot of times if this muscle is very short, that means these muscles on the backside of the neck get elongated and they start causing pain, which makes you want to self-massage the back of the neck, do a little stretching just to help out those muscles back there. But by loosening up the muscles on the backside, that allows the sternocleidomastoid muscle to get even shorter, causing a vicious cycle. If you feel like your head is out in front of your body, you want to massage this muscle. If you tend to get a lot of headaches, especially with referral patterns causing pain behind the eyes, the top of the head, the back of the head, try massaging this muscle. All it takes is maybe about 2 minutes or so, and after working this muscle group, it's amazing how your head will feel back over your shoulders again. Don't just take it from me, look at this trigger point referral chart. As you can see from that sternocleidomastoid muscle, we get referral patterns going behind the eye, the top of the head, the back of the head, and for a few people that are very tight, they might actually feel some pain behind the ear or even a ringing in the ear because of this muscle. You have the sternocleidomastoid muscle, or SCM muscle, on each side of your head. Sometimes they're not even. One might be shorter than the other. One reason for this would be someone who's on their phone a lot and has the phone between their shoulder and their ear. If the muscles are uneven, that causes the head to be tilted. And when the head's tilted, sometimes you get some dizziness and referral patterns, much like having vertigo. Another good reason to work this muscle out. So now, how do you self-massage this muscle? Well, the first thing you have to do is find it. I'm going to work on my left side first and try to find the muscle. In order to do this, I can turn my head to the right to make the muscle pop up. If it's still hard for you to find it, you can apply a little pressure against the head to make it pop up. And when you do find the muscle, try to do a pincer grip on it and then turn your head forward to give that muscle a little slack. So now I'm in that pincer grip and I'm just going to go up and down the muscle slowly. Move it from side to side to displace it off the underlying tissue. If I find a spot that's pretty tender, I'm going to hold. And I'm just going to hold here until that spot feels less tender. And then I can continue moving up and down the muscle. You're nowhere near an artery, but if you do feel a pulse, get off it. And once I'm done with this side, I can turn my head and find it on the other side. And compare the two sides too. Maybe you do notice one muscle is a little bit more tied down on one side versus the other. And again, I'm just going to do a little pincer grip, try to lift the tissue, move it from side to side. If I find a tender spot, I'm just going to stop and hold. And all it takes is a few minutes. And when you're done massaging, stand up, move your head around, and you'll be surprised how much better your head feels. It feels like it's back on the top of the shoulders again. Thank you for putting up my first video. I'm Rob with Wad Body Sports Massage, and we hope to see you on the table soon.